Hi, my name is Elnetta Burnell. I'm going to demonstrate how to use insert a Foley catheter. First, I'm going to check the doctor's order, making sure I follow the five rights: right patient, right procedure, and check her allergies to see if she's allergic to iodine or latex. And I have checked her chart, and she's not allergic, and her orders are in the chart. Now I'm going to enter the room. Good afternoon, Miss Smith. How are you today? I'm good. Now, Rebecca's ordered a Foley catheter to be inserted. The reason for the catheter is to collect your urine. You've been having some difficulty with urinating, and we want to make sure that you're, you know, able to pass your urine. Is it okay if I do the procedure? Yes, ma'am. Okay. Give me 1 second. I'm going to go ahead and wash my hands and put on my PPE equipment. I have applied my PPE equipment, my gown, and my mask. Applied my goggles, and I have completed my hand hygiene because I have put on the mask and everything. I'm going to use some hand sanitizer. I'm going to don on my gloves, gather my equipment, consists of the Foley catheter pack. Next, I'll close the patient's curtain and close the door for privacy. Okay, Ms. Smith, we're ready to get started. I have flattened her bed and make sure she's comfortable. Are you okay? Everything's okay? You're okay lying this flat? Yes, ma'am. Okay. And I pull up the blanket to expose her and I explain to her that I'm doing that. I have to expose your vaginal area and put you into a dorsal recumbent position. I help her with her knees and she scoots down, remove the filter, let her scoot down. I have to explain to her each and every step so it doesn't come as a shock for when I do it. Next, I take a draping, waterproof draping, have her to lift her bottom. She's lifted her bottom and place the waterproof pad underneath her. Next, I'm going to clean her area. It has to be cleaned before insertion. My hospital uses pre-heated wipes for the patient that assist in cleaning. With my non-dominant hand, I'm going to open her vagina to expose the labia. Then I'm going to clean away from me and to me, down to the anal cat, and place it on the side. I'm going to take another wipe, go to the other side, using a clean wipe each time, and place it to the side. Take the last clean wipe and go straight down the middle. After doing that, I'm going to remove my gloves and perform hand hygiene. Take the photocatheter kit and I'm going to open it. Remove the contents from the bag and place it in between the patient's legs. Post the patient's legs. Perform hand hygiene, making sure that the patient is still comfortable. Are you okay, Ms. Smith? Yes. Okay. I'm going to be careful to open the kit, pinching towards the end. and opening each portion of the kit, maintaining the sterile feel. I located my gloves. Take the sterile gloves out of the packaging, and I'm gonna go over to my table, my clean table. I'm going to open the package, facing me, exposing each part. I see the left and the right glove. I'm going to open the dominant side, which I'm left-handed, but I really can use both in placing this catheter because I use both hands. I want to pinch the outside, maintaining maintaining the sterileness of the glove. Put the glove onto my hand. I'm gonna always keep this sterile feel, and then I'm going to pinch, shove my fingers under the cup of the right glove and put it on my hand while maintaining the sterile feel. I'm going to go towards the patient. I'm going to open my sterile dressing, my sterile mat, placing the shiny side down and have the patient lift up. Please lift up, and we're going to place that, maintaining a sterile feel. Next, I'm going to take my fenestrated grape, open it while maintaining sterility. Shiny side down and placing it over the vaginal area. I am going to remove my sterile cup for collection if I have a urine collection. I'm going to remove my tray, place it on the sterile field, and I'm going to check all of my other devices inside to make sure I have everything. I have a 10 cc syringe full with saline put at the base of my Foley to inflate after I have inserted the cap to the side. We have a lubrication that I'm going to place on this side of my tray. The lubrication is the place for the end of the catheter, so it will go in smoothly into the fascia. We want to lubricate this 2 inches of tip while maintaining sterility on the place, tip of the catheter inside the lubricant. Turning it, making sure I get full coverage, at least 2 inches. There are some facilities that want you to inflate the bubble to test it, but the new rule is now that they don't want you to inflate it to maintain the sturdiness of the catheter itself. I have wipes, iodine swabs that I'm going to use to clean area, the labia. I'm going to open the swabs, and I'm going to leave them in the package because it can cause a mess. Well, I'm going to put them on the tray so it'll be easier to to grab when I need it. With my non-dominant hand, I'm going to let the patient know that what I'm doing, I'm touching you, if that's okay, and open her vaginal area. Furthest from me, I'm going to wipe in the labia, one side, toss the swab, take the next one on the other inner side, wipe the labia, and then I'm going to go straight down the middle. Once that is complete, I'm going to take my Foley tip and I'm going to insert it in the urethra. Sorry. Place it into the urethra about 2 to 3 inches or until I see urine. I see urine. Once I see urine, I'm going to insert it another 2 inches. Then I'm going to, with my non-dominant hand, I'm going to hold the Foley in place and inject saline, the full 10 cc's of the saline to inflate the bubble. Once that's in place, I'm going to do a slight tug to make sure that the Foley is set and in place. Once that is complete, I take off the syringe, place it to the side. I have my urine within the bag. Take it out. I'm going to tear the fenestrated drape. And now I'm going to just move it. But I am tearing the drape and removing it while the Foley is in place. Then once the Foley is in place, I'm going to attach the line, give it some room so it won't be too tight, and attach it to the patient's inner thigh. While I'm attaching it, I've put the date, the time of the insertion of the Foley. And once it is finished, I'm going to hang this Foley to the side of the bed. If necessary, at that time, I'm going to collect a urine sample from the port. Urine sample will be collected from the port. Once I'm finished, I will dispose of all of my equipment in a garbage bag that I have at the bedside table. I've already obtained my urine sample, patient's name, and the date and time that I can send down to the lab. The Foley is inserted and hanging at the patient's bedside table. I'm sorry, on the bedside, making sure it does not hang on the rail because we don't want her to be injured. We're going to remove all the rest of the equipment and we're going to get her covered up. Close her legs, get her covered up, back on her pillow, get her in a comfortable position. Check with the patient. Are you okay, Miss Bear? Yes. Okay. Put her call light in place. Put the head back into its position. Get rid of my trash and document. You always have to document the time, the date, and the size of the catheter.